I'll not leave my beeper because my beeper has my business. This is TGT Live. I'm DK Roster. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TGT, Talk City 91.1 FM, and on Facebook at TGT Live Online. We go now to Al Alexander, Senior Corporate Communications Officer at the Ministry of Health.
Good morning, and thank you for joining us for another Ministry of Health virtual media conference. These media conferences are intended for you, the public, to hear directly from the medical subject matter experts themselves. We remain committed to providing you with the relevant and accurate, up-to-date information on the national COVID-19 response. Our panelists today are Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, Ms. Alicia Baksh, CEO, Northwest Regional Health Authority, and Dr. Hazel Othello, Director, Mental Health Unit, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's program. We begin with Dr. Hines, who will present the clinical update.
Thank you, Mr. Alexander. Good morning to Ms. Baksh, CEO, NWRHA. Good morning to Dr. Othello. Good morning to members of the media, members of the viewing and listening public. This morning, the clinical update is as follows. As at the 23rd of May at 4 p.m., we would have completed 165,776 COVID-19 tests between the public and private facilities. Of those, 20,017 have returned as positive. Of those individuals, we have 11,480 who are designated as recovered patients, and 8,162 cases that are considered at the current time to be active positive cases. Those active positive cases are broken down as follows. There are currently 472 patients in the hospital. There are 179 patients in step-down facilities, and there are 6,938 individuals in home self-isolation. There have been 375 fatalities to date, and we extend our condolences to the members of those bereaved families. Among those vaccinated, we now have a total of 66,299 persons who would have received their first dose of one or other of the vaccines currently are in circulation, and those individuals who are fully vaccinated, having received the first and second dose, currently stands at 1,179. In terms of hospital occupancy, the current overall occupancy as of 8 a.m. today, May 24th, is 72%. The ambulatory, that is the ward level occupancy, is 76%. ICU occupancy is 85%, and HDU, that is the high dependence unit occupancy, is 16%. From an epidemiologic standpoint, the points to note, the key takeaways are that we continue to see cases rising in the population. We would have had 573 new positive cases identified in the last update, and those cases would have been from samples that were collected between the 18th and the 22nd of May. So as we see continued positive cases in the population, and as we see the levels of occupancy holding at the high 70s for ambulatory, high 80s for ICU, we do want to continue to remind the population of the importance of holding to the measures, as some of us have been doing. And the extent to which we've been doing this is the extent to which we will continue to see, hopefully, the impact of the measures in terms of slowing of the numbers of cases. So we want to encourage those who have been holding fast, who have been doing the things that have been required and requested, who have been maintaining their distance, who have been reducing their movement, those who have been wearing their masks. We want to encourage you to continue to do that and to thank you for holding fast to those recommendations. and to encourage those who may have had some challenges in holding fast to continue to try, to continue to make the effort to reduce your movement, wear your mask, sanitize your hands. The extent to which we do this is the extent to which we will have the kind of desired impact that we want with respect to the occurrence of new cases. So that brings me to the end of the clinical, hospital, and epidemiologic updates. I turn you back to Mr. Alexander.
And thank you very much, Dr. Hines. I now hand you over to Ms. Baksh, CEO, Northwest Regional Health Authority, who will present an operational update for the Northwest Regional Health Authority. Ms. Baksh.
Hi, good morning. Dr. Hines, Dr. Othello, Mr. Alexander, members of the viewing and listening public, media personnel, good morning again. I'm here this morning to give a brief update as it relates to NWRHA's operational activities over the past week. As you would recall, we were tasked with the responsibility of operationalizing one of the 2 field hospitals which were donated by the United States government to the government of Trinidad and Tobago. And as you would imagine, many efforts were made to operationalize this field hospital in the shortest possible time as it augmented the current parallel healthcare system. After expending a lot of time and energy, we were able to operationalize the field hospital, which is located at the Jean Pierre Complex, in approximately 3 days. Staff worked long hours to ensure that all the infrastructural facilities that are required to make this field hospital functional as a normal hospital were in place. We would have expanded the bathroom facilities for patients. We would have also partnered with the TNTech to ensure that we have a regular supply of electricity at the field hospital. Although the field hospital came with its own backup generators, we decided that we would like a continuous supply of electricity, which was done by TNTech, and we are utilizing the backup generators as backup power in the event of any electrical outages. In addition, we would have ensured that all required IPC infrastructures are in place, because you would know that it being an environment that would be treating COVID-19 patients, our IPC protocols must be strictly adhered to. Many logistical arrangements were also implemented to ensure that this field hospital is self-sufficient as a regular hospital. So some of the arrangements in place would have been laundry, meals, biohazard waste, laboratory services, as well as medication supplies. As it relates to staffing this field hospital, we would have rationalized our nursing, medical, and administrative staff in an effort to redeploy the correct numbers and correct personnel in order to provide the patient care that is required. In addition, as it relates to ancillary staff, whilst we did have some persons that we utilized, we also recruited additional persons to provide those required services, such as wards maids, attendants, and environmental staff. In an effort to ensure that our staff are provided with the amenities required so they can provide optimal care to the patients being housed at the field hospital, we ensured that we outfitted staff rest areas to ensure that they are taken care of. We provide meals and beverages to them. We also provide transportation services to those employees who require same. With respect to ensuring that we prevent staff burnout at the facility, we have our employee assistance program, which is available to all staff members to access. We also have our mental health hotline between the days of Monday to Friday, 7 a.m. to 3 p.m. that staff can call and speak to either a psychologist or psychiatric social worker to assist them in any way that they can. As it relates to our regular hospital operations at NWRHA, in an effort, of course, to reduce the crowds at our outpatient clinics in light of the present state of emergency, we would have expanded our telemedicine initiatives. Urgent cases are still being seen. Chemotherapy and transfusion appointments continue. Urgent and emergency surgeries are being done, and the refill of prescriptions are being done on clinic days. And these are all in efforts to try and reduce the crowds at our various outpatient clinics at our hospital facilities. This is the end of my operational update as it relates to our activities. Thank you.
And thank you very much, CEO. We welcome back Dr. Hazel Othello, who will present some additional advice for us to better cope with pandemic fatigue and the ongoing state of emergency. Dr. Othello.
Good morning, Mr. Alexander, Dr. Hines, Ms. Bash, viewing and listening public, and media practitioners. This is a difficult time for all of us as citizens of Trinidad and Tobago, but more so for those who have lost loved ones to COVID-19, those who are currently battling the disease and their loved ones, and the many valiant frontline healthcare workers who continue to be sacrificial in their attempts to save every possible life. I extend heartfelt condolences to the many who are grieving at this time, and I also extend encouragement to my medical colleagues, our nurses, and all our ancillary staff. May God's grace, His peace, and His strength continue to sustain you. Today I want to remind Trinidad and Tobago yet again of the importance of taking care of our mental health during this time. As we are well aware, our country has been facing very challenging circumstances over the past weeks, and we are once again dealing with the many complexities of stay-at-home life. In addition, the daily news of new persons testing positive, the status of the healthcare system, and additional deaths is facing us all. How do we cope with all of this, emerge as healthy individuals, and continue to make positive contributions to society? The answer is exactly what many mental health practitioners have been recommending from the very beginning of the pandemic. I know you're very familiar with the 3 W's that has been shared very, very often. Wash your hands, watch your distance, wear your masks properly. Today, I'm introducing you to the 3 S's. Self-care, support one another, and seek help. I'll talk a bit about self-care first. And I know I've spoken on this topic before, but today I want to emphasize the importance of managing your information exposure. If the daily round of social media feeds about the pandemic layered on top of the 24-hour news cycle has been making you feel irritable, depressed, anxious, or just stressed, it's time to place some limits on your news exposure. Just turn it off. Trust me, we don't need to know about every scary development the moment it happens. Sometimes we have to separate ourselves for a while. But if you don't have something structured, something planned to do during the time when you would normally have been, looking at the television or reading social media posts about these things, if you don't plan something to fill that time, you're likely to still spend that time worrying. So it's important to spend that time in meaningful activities that are relaxing and enjoyable to you. Right? It's important to exercise, so that's one of the things you can do. Of course, you have to do it at home now, but that's all right. There are lots of things we can do. We could run up and down steps or walk in the yard. Plus, there are lots of videos on television. There are social media exercise, exercise routines with trainers that you can follow. So there's lots you can do at home in order to get some exercise. You can also participate in family activities or group activities. These can be done with your immediate family who lives in the same house with you, or virtually with family members elsewhere or friends who are elsewhere. And there are lots of those, there are lots of activities you can do that way. People have been having family reunions and things like that virtually. I've even seen virtual birthday parties. And then, of course, relaxation exercises. If you've learned relaxation exercises as part of your therapy process because you've been seeing a therapist for some time, continue doing them. If you've never learned relaxation exercises, there are some very easy breathing exercises that you can find, that you can simply, search on the internet and just follow the instructions. They usually have somebody demonstrating how to do it, and they really, really help you to exercise, to relax. They take the heart rate down, they get the breathing back to a normal pace, and they help you to feel better. Another important aspect of self-care is managing your work from home hours. I know for those of us who are internally motivated and have demanding jobs, this could be challenging. However, be aware that maintaining a healthy work-life balance is very, very important. It reduces stress and it helps to prevent burnout. So that's something that we all have to be aware of and that we all have to manage. So that's self-care. And now I'm going on to talking about supporting one another. And this is very important. If you can provide assistance to someone, please forgive me, this mask is a bit difficult to manage today, but I'll do my best. If you can provide a listening ear to a friend or a relative in distress without yourself becoming emotionally overwhelmed, please do it in order to support that person. However, if providing that support to that person is overwhelming you, or if you're beginning to realize that person needs more support than you are capable of providing, or that you should even be trying to provide, please help that person to seek professional help. And that takes me, of course, to the third one, which is seeking help. It's okay to seek help. Don't fear stigma. Don't allow fear of stigma to prevent you from getting the help that you need. And of course, if you don't know where to find that help, please reach out to findcareTT.com. That is our directory of services. It's on the internet and it's easy to find. If you type in Find Care, the rest of it comes up very quickly. And it allows you to look for different types of services that you may need. There are several helplines there, and the services are all entirely free of charge. So I urge you to remember and practice the 3 S's: self-care, support one another, and seek help. Before I close, I must mention that I've been seeing and hearing many expressions of genuine concern about the impact of the increased service demand on our frontline healthcare workers. And I'm glad Ms. Bash spoke today about the initiatives the Northwest RHA have put in place to assist those workers. And I'm sure, in fact, I know for a fact that the other RHAs have similar things in place. In anticipation of this, the Mental Health Unit of the Ministry of Health, in collaboration with PAHO, conducted a webinar on self-care for frontline healthcare workers as far back as the middle of 2020. In addition, the Mental Health Unit has been collaborating with the mental health service providers at the RHAs to ensure that the arrangements that were put in place since last year for the provision of much-needed mental health support to frontline healthcare workers remain available, accessible, and responsive. In conclusion, let's remember that the current restrictions have been put in place purely for our protection. And being mindful of that fact, let's do everything possible to keep ourselves and our loved ones physically and mentally well throughout this pandemic. So please remember the 3 S's: self-care, support one another, and when necessary, seek help. Thank you.
And thank you very much, Dr. Othello. I will be remembering those 3 S's. And I know, and I know the public would be using that website, findcareTT.com. As we move into our question and answer segment, a reminder to our media representatives to begin by stating your name and your media house before you put forward your questions to our panelists. Please, no more than 2 brief questions at this time. And of course, if time permits, we will accommodate 1 question from each media house. We begin this morning with GM Guardian Media Communications.
Hi, morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is to Dr. Hines. Right now, with these restrictions, we're kind of taking it a day by day, taking it day by day, and we'll continue to monitor it. But I just want to set some goalposts and some targets here. Given what you would have been seeing over the past week or so since it's been implemented, like with regards to the places of infection, as well as how many people we would have anticipate or how many people we anticipate of being infected in the country that we haven't detected yet, if everyone was to hunker down right now and do exactly what is being asked of them, how soon can we really see any sort of difference epidemiologically? How much can we see these cases come down, and in what time frame, like probably even 2 weeks or what? And to Dr. Othello, over this period of restrictions, have we noticed any increases in anxiety, depression, unfortunately, any kind of suicidal thoughts, anything like that? What has the effects of this been noticed by the ministry?
Thank you. Dr. Hines, yes?
Thank you for the questions. Now, with a global pandemic, with a local pandemic, it is a little premature to attempt to set fixed goalposts and strict timelines at the start of an intervention of the nature that we begun by the most stringent of the restrictions, that being the SOE. So as you very rightly described, the SOE is asking everyone as much as possible to hunker down, reduce their movement and their interaction so that we reduce the opportunity for the virus to move from one person to the next. Now, as we said on Saturday, some of the larger but not quite as stringent as SOE restrictions that had been implemented were begun on the 29th of April. And as we've seen in previous cycles of these restrictions, it takes approximately 2 weeks to begin to see whether there is an effect or not. What we have seen or been seeing is that in the 2 weeks since that, we've seen, while we're still seeing an increase, or we're still seeing large numbers, we're not seeing that increase being as exponential as it had been. It didn't remain on that very exponential track that it was on in the last 2 weeks of April. And we attribute that to some extent to some of the reductions in mixing beginning to have the desired effect. With the enhanced restrictions implemented and imposed by the SOE, if, as you say, everyone hunkers down, if everyone begins to really take as much precaution as possible, then you will start to see the effects of that 2 weeks from the SOE. That first week, you'll see whether there's any real change in trajectory, and the weeks afterwards will give us a better idea of where that change in trajectory will take us. So when we see the change in trajectory is when we start to be able to make additional predictions with regard to how soon we'll get back to a particular point in the cycle of the epidemic. So it is premature to try to set those goalposts at this point in time. However, what we want to encourage is the continued adherence that we are currently seeing. We know that a lot of people are really trying, and those who have been still moving around a little more than they need to, if you also try to add your weight to the side of the seesaw that brings the cases down. That's all we can ask of the population at this point in time, and that is all we are asking. If everyone adds their weight, as you've just said, if everyone hunkers down, then we're going to bring the weight to the side of the seesaw that brings the cases down, and we're going to see a faster decline than we're currently seeing. So we do want to encourage that sort of behavior, everyone hunkering down so that we can speed up the decrease. Thank you for the question.
Thank you, Dr. Hines. Dr. Othello, I invite you to address the second part of the question.
Good morning, Mr. Khan. Throughout the pandemic, we've been seeing these mental health diagnoses as being as ever present as they've always been. In order to measure increases, clearly we need research, and the publications that are emerging from local research are just beginning to pop up on the horizon, so that I'm sure that some data will be available at some point in short order in terms of earlier in the pandemic. It's too early to measure increases for this current lockdown because it only started a few weeks ago. However, that's why we continue to provide guidance to tell people what they can do to keep themselves well, as in addition to ensuring that care is available for those who are having difficulties, because we anticipate and expect that those difficulties will occur and that we need to respond to them. Thank you.
And thank you very much, Dr. Othello. We now go to 98.1.
Good morning to you, Mr. Alexander, and to the panel, Stephen Cummings, 98.1 FM. Two questions quickly, one for Dr. Tello and the other for Dr. Hines. And I'll start with Dr. Tello. Just to take off from that previous question, Dr. Tello, I know during the earlier period of the pandemic, a study began on the mental health of the nation. And I want to press the question further. How far has that study been advanced? And do you really understand, or do we really understand the psychosocial economic impact, not only resulting from the pandemic, but a state of emergency doubled with a curfew? And of course, we have the public health restrictions on the population. And my deeper question is, what would be the ultimate social cost? And Dr. Hines, a coronavirus breathalyzer, I understand, is now being tested, seen as a new diagnostic medical testing device, and I'm told enabling the user to test with 90% or greater accuracy the presence of severe acute respiratory syndrome, coronavirus 2, in an exhaled breath. Now, it has been also brought to my attention that this is also a new system of testing that's being used in Singapore, and we have long touted Singapore as being among the more advanced in the region. Is this a new?
Okay, I think we would have had a pause there, but I think we got the sense of the question. So I now invite Dr. Teller to treat with the first question.
Overall testing for the virus. Thank you.
Good morning, Mr. Cummings, and thank you for that question. I'm aware of several ongoing studies, some of which are in publication as we speak, so I'm not sure specifically which study you're referring to. However, the ultimate social cost of this depends on the mental health response, because we anticipated that there would be mental health fallout. We anticipated that very, very early in the pandemic. And that's why we've continued to ensure that regardless of the demands on the mental health services, the demands on the general health services, the mental health services continue to be available. And that's why we set up the Mental Health and Psychosocial Support Technical Working Group, and that group continues to meet every other week. We met up to last Tuesday, and we do that to ensure that the services are ongoing. I can tell you some services that had slowed down when the number of cases were less and when things were quieter in terms of the progression of the pandemic have begun to ramp up their services again in order to meet their growing need. So that we are aware that our response has to be robust, and we're taking every step possible to ensure that services are accessible, available, and, as I said earlier, responsive.
Thank you very much.
Okay, thank you. Now, we did lose the very end of your question, Mr. Cummings, but I'm going to go ahead and presume that you're asking whether this is something that will be considered. Now, any new technology will have to sort of run its course, have some additional level of external or international support with respect to the research behind it before it then moves to something that would be high up on the list of things to consider. We do continue to scan the international literature for additional technologies, additional approaches to enhancing our abilities to respond, and responding includes detecting. But at the present time, the technologies that we have at our disposal are the ones on which we will be relying, and we'll continue to review the science in the international literature to decide whether expansion is necessary and worthwhile.
Thank you very much for that response, Dr. Hines. We now go to Newsday.
Good morning, Narissa Fraser from the Newsday.
Morning.
Firstly, I wanted an update on the oximeters that at one point the Health Ministry would have been distributing to patients under home quarantine, because some people have been asking us to find out, is that still a thing? Are those still being issued to people who are in self-isolation? And secondly, police officers are now asking for priority to be tested because they want their results processed faster so they could return to work sooner. I wanted to get the ministry's thoughts on that.
Thank you very much. Dr. Hines, if you could treat with these questions.
Thank you for the questions. With respect to the oximeters, I believe that there may have been an issue with respect to supply and demand. I will have to get the information on how far that got with regard to resolution. And with respect to the second question, you may not be aware, but the Ministry of Health does have a very close interaction with the TTPS via a focal point, via a liaison that sits on our interministerial and multidisciplinary committee. And to the extent that it's possible, we do try to facilitate requests, especially when groups of officers may be affected by a particular exposure, etc. So there's a dynamic interplay in place behind the scenes to try and ensure that this very crucial group doesn't get adversely affected by the exposures that they have and by any delays that may occur in the testing cycle. So we're already working on doing those things behind the scenes, and we will continue to do so.
Fantastic question. Thank you very much for the response, Dr. Hines. We now move to Loop TT. Loop, you're ready for your question.
Good morning, everyone. Nika Arsenal here from Loop TT.
Ms.
Baksh, I'm actually really glad that you're here because I did intend to reach out to you today. We've had some reports recently from a number of staff members, medical staff members at the Port of Spain General Hospital. They've raised concerns about the current Chief of Staff's manner of communication with them. They say that she's been terse and sometimes a bit abusive. More than that, they're also claiming she's told them that they will not be receiving any overtime for extra hours worked, even though they've had to go above and beyond in the pandemic. And she's also gone as far as to tell them that they may need to help drive ambulances. Can you explain the administrative processes regarding extra duties and overtime that are in place for the medical staff over there? Is this normal or acceptable?
Hi, good morning. Thank you for your question. As it relates to any category of staff, overtime does apply once they are working in excess of their required hours. In the event that overtime payments are not done, they do receive compensatory time off. So they do receive some form of benefit, either in monetary form or in time off. As it relates to staff driving ambulances, we have ambulance drivers. We have ring-fenced certain ambulance drivers as well too, with respect to our present facility at the COVID-19 hospital. So I cannot confirm or deny that statement. So as it relates to the overtime question, they do receive some form of compensation, be it monetary or time back. As relates to the ambulance drivers, we do have ambulance drivers, and we have identified certain ambulance drivers with respect to transporting COVID-19 patients. So that is the arrangements that we have put in place at NWRHA. Thank you.
And thank you very much, Ms. Baksh. We now go to I-95.5 FM. I-95.
Good morning, everyone. Yes, good morning, Al. Good morning to everyone. Whitfield Turner from I-95.5. Ms. Baksh, I'll stay with you for my first question, just to get this issue clarified. When someone dies of COVID-19, who foots the bill for the funeral? Is it the state or is the family supposed to pick up that tab? And does the family get the body at any point in time during that process? And my second question for Dr. Ortello. Dr. Ortello, notwithstanding all that you have said this morning and in previous times, one of my concerns is that we might be entering into a pandemic within a pandemic in so far as mental health is concerned. We have measures in place, but the toll of being kept physically apart and so forth, all these measures, the impact of that on mental health to me seems to be growing from the persons I've been speaking with. There's an increased concern about that impact, even though we have all these call centers and so forth in place. Is that a position that you would agree with? And has any consideration been given to outsourcing some of these services to companies that may be able to provide mental health services?
Hi, good morning for your question. As it relates to persons who are deceased from COVID-19, the Funeral Association has identified a number of funeral homes that are on their listing of meeting the requirements to deal with COVID-19 bodies. So when there is a deceased, we would normally contact the family members, identify and give them that listing so they can choose if whichever funeral agency they decide on going with, be it for religious purposes or not. And they would take care of the funeral arrangements and pay that cost. In the event that families are unwilling to do so, what we have done is we would normally bear that cost, especially when our mortuary is becoming filled and we would need required spaces. So in an effort to remove the bodies, we would have to bear that cost if the family members are unwilling or are unable to do so. So that is the usual procedure. And in terms of taking care of the deceased bodies, the Ministry of Health has developed a protocol as it relates to that, and that protocol is being followed by the Funeral Association, as I identified before. Thank you.
Thank you very much, Dr. Othello.
Thank you for your question, Mr. Turner. I too have heard those comments about a pandemic within a pandemic, and it's an interesting perspective. I'm not sure if the escalation in mental health needs would fit the scientific definition of a pandemic. I don't think it does. But I understand what is being communicated by that term, and it's a concern for the escalation of mental health difficulties within populations as a result of the impact of the pandemic. And it's a real concern. And it's a concern that we've been aware of from the beginning of the pandemic, and that we are increasingly aware of as at our local level, we feel the impact of the pandemic in a greater way at this time. And that's why the measures that I've mentioned have been put in place. In terms of your question about outsourcing of services, that is a decision that the RHs make based on their operational capacity. In other words, they assess the need within their service at the time, and if there is a need to outsource to external EAP services, that's a decision that they can and do make when it's needed. Okay, so that's an operational decision at the level of the RHE.
Thank you very much, Dr. Othello. We now move to CL Communications. Good morning.
Hi, good morning. Basically, I just wanted to find out, can you give an update on the oxygen supply at the Quora facility? And secondly, what is the Ministry of Health's position on the sale of PCR test kits over the counter? And I was just curious about this one. Is Trinidad and Tobago interested in like the digital passport, or we're going to be using that in the long run? Thank you.
Thank you for your 3 questions. Dr. Hines?
Does she get to pick 2 questions out of those 3? Okay, the 3 short questions, so we'll try to address them. With respect to oxygen availability at all the facilities within the health system, oxygen is adequately available, full stop. With respect to PCR, now there is no PCR over-the-counter kit. PCR is a complex laboratory procedure that is only conducted within a formal laboratory environment. So I'm not sure what information you're operating with there, but there is no over-the-counter sale of PCR kits because PCR is something that can only be performed in a laboratory setting. What was the third question? Digital passports, now that's going to be a policy level decision that will be taken at the level of either the Prime Minister, the Minister of CARICOM and Foreign Affairs, the Minister of Health, or probably all of them together. So that is not something that I'd be able to address at this point in time. But if such a consideration is tabled, then that will be announced by the appropriate level within the system.
Thank you very much, Dr. Hines. We quickly go to AZP News. Good morning, AZP News. Okay,
yes, good morning, Priya Bihari, azpnews.com. My first question is for Dr. Hines. Dr. Hines, I want to talk about the testing again, and how are the cases reported with respect to the period from which the samples are taken. For example, for yesterday, the 573 cases stating that it was reported in the last 24 hours, but there were samples taken for the period May 18th to May 22nd. So therefore, and then the Saturday new cases would have been taken from samples during part of that same period. My question is therefore, how does the ministry report these samples? In other words, if a sample is being reported from Thursday samples, in other words, would they report Friday too? And in other words, would the Friday samples be done before Thursday or after Thursday? Because people are concerned about how the ministry chooses to report the samples, right? My second question is for Dr. Othello. Dr. Othello, we have AZP has spoken to a number of doctors and healthcare workers, for example, and they are a bit, some of them say they are demoralized because they are dealing sometimes with death on a daily basis, and they need some counseling. I sense, they don't say that, but they seem very hurt and overworked and concerned about the environment in which they're working. And I don't know if there's any assistance that you can offer to them. Thank you.
Okay, thank you for the question. Now, there seems to be either confusion or misunderstanding of what is published when we put these updates out. There is for example, today, the update from May 23rd says 573 cases reported in the last 24 hours. Now, they also go on to say the period of time or the span over which the samples reported in the last 24 hours were actually collected. Now, what we do is we look at the number of positives that have come out of the runs that have been conducted in the 24-hour period. In that 24-hour period, all the labs will do the various, what we call runs. We take a group of samples and they test them, and they then document how many of those are positive. You add those up, and that will give you your 573. Now, the samples themselves have different collection dates. So when we give you the span of time, it's just we're looking at the range of dates included in that batch of samples that has been reported on for the last 24 hours. So when we do a 24-hour update, meaning the runs, the tests that were performed in the last 24 hours, these are the results. You got 573 new ones. And we look at the span or the range of dates that those samples encompass. And we say, well, the earliest date in this group was the 18th. The latest date was the 22nd. So hopefully that clarifies. So tomorrow there may be another set, which may include some more from the 22nd, because we just look at the number of samples that we have positive and the range of dates on those samples. And then we explain this encompasses samples from date A to date B. I'm hoping that clarifies. If it doesn't, then we're happy to try to clarify further.
Thank you very much, Dr. Hines. Dr. Othello, could you address the second question?
Thank you for your question, Mr. Bihari. And I want to urge my colleagues, particularly junior doctors who are having a difficult time, as was described by Mr. Bihari, please reach out for the help that is available to you. Please, please, please use the services. Right? Within each RHA, the mental health department has numbers that you can call. So please reach out to the department, get the numbers, access the help. There are psychologists, there are social workers who are ready to take your call and to assist you. Sometimes it's in-house, sometimes it's outsourced through our EAP, but the services are available. So please use them. I understand that this can be difficult. I understand that when we're training as doctors, we don't train for something like this. We don't expect something like this to happen. It's happening. It's difficult for all of us. It's more difficult for those of you on the front line, and particularly for junior doctors, young doctors, recently graduated doctors. Please, please, please use the services. We want you to be well. We want you to be well taken care of.
Thank you very much, Dr. Othello. We now move to TV6. We are ready for your questions.
Good morning, Urvashi from TV6. Dr. Hines, we would have asked you, I don't think it was last week, I think it was the week before, why more people are dying. You would have gone through some pains to explain to us that it wasn't that more people are dying, it's just that because there are more infections, there will be more serious cases resulting in more deaths. Now, subsequent to that, we saw that PAHO just last week said that Trinidad and Tobago is among countries in the region where deaths would have doubled in the last week. I'm assuming last week and the week before. Are you now in a position to tell us why more people are dying? And if not, can we then look at if it is that poorer people or people in the lower income bracket are dying? Because when we look at it, or is it people in certain occupations that are dying? Because we're seeing, for instance, tea and tech, police officers, supermarket workers, hospital staff, they are those working in those enclosed environments. We don't know if they could afford, as some would be able to afford those at-home oxygen tanks or this new drug that people are now hoarding. So they have to rely on the healthcare system and they're just not getting through. We are seeing that that is where the infections are taking place. And maybe they're taking it home to their 1-2 bedroom apartment or house that they may have 5-6 other family members and infecting them as well. Is it that poorer people are now dying? Can you tell us who is dying if you can't tell us why? And secondly, can you tell us what the vaccine policy is of government? In phase 1, we were told that it was above 60, those elderly persons with NCDs and so on. And now we're seeing, when you go to the ministry's website, it's over 60, and then you're seeing under 60 with NCDs. But online, we're seeing all sorts of people getting vaccines. Persons online, persons who've reached out to us from the public would have said that those are young, healthy persons, some are connected, and some are wealthy. Can you tell us what is the vaccine policy? Thank you.
Okay, thank you for your 2 questions. Now, the first one, now, I think we need to make the distinction between numbers of deaths and death rates. For the month of May, we would have recorded so far 206 deaths. So total numbers will have increased, and that is, as we have said, because there are larger numbers of individuals infected. Now, when we look at the overall case fatality rate, the number of deaths, 375 over the total number of positives currently, which is 20,017, we get a case fatality rate of 1.8 something. And that has been really within the sort of the range that we have seen at the height of the previous peak. At the height of that previous peak, we were around 1.8. At some of the lower points, we drifted down to 1.6. But we've varied between 1.6 and 1.8 throughout our peaks and troughs in this particular pandemic. So when they say the number of deaths has doubled, that's a number. It means we've accumulated more fatalities, but it is not that the rate of death has increased. I'm hoping that that clarifies. Now, moving on to the next part of your question, which is also very, very important. As more people become infected, as we have people bringing the virus into various kinds of household settings, it is really important that anybody who is either diagnosed, exposed, or just ill remembers to the greatest extent possible, follow the isolation guidelines, recommendations that are on the Ministry of Health website, around reducing the risk of spreading your illness to other people. So I'm going to go through those three groups again. You've been diagnosed, as in you had a test, it came back positive. Or you were exposed. You haven't had a test yet, you don't know whether or not you're positive. Or you're ill, no test, but you have symptoms. Once any of those scenarios is in play, then we want to encourage the individuals in those settings to find ways to implement those guidelines to reduce risk. So secluding yourself to a particular room in the house, or the wearing of masks, the use of single-use items, utensils, not sharing things. If there's one bathroom in the house, then there's a sequence or a scheduling for everyone else who wasn't in that exposure category. Use the bathroom first, clean it down with your household cleaners, then the ill person uses it afterwards and cleans it down again. All of those mechanisms are the things that we're going to use to our advantage as a population to reduce the risk, as you very rightly identified, of in-house spread. Now, the virus does not distinguish or discriminate between any socioeconomic group. So everyone across the socioeconomic spectrum has had these cases, and in the settings where the household doesn't allow for massive amounts of distance between one individual and another, the behaviors have to compensate for the physical structure. Now, the government policy is as has been outlined in your second statement. At the current time, we are vaccinating individuals 60 and over, regardless of NCD status, and we're vaccinating individuals under 60 with NCDs. That is the policy at this point in time. We did, I think we had a conversation previously about individuals who reported that they went and they get through with getting a vaccine, and in some cases it would have been because either someone else missed an appointment, skipped an appointment, a vial with a multi-dose vial with 10 doses or sometimes extra was in use and vaccine was available. So there was opportunistic use of the available vaccine in that setting. Reminding us also that, I believe this is also said, the current vials of the Sinopharm vaccine are smaller vials, less extra. There's only going to be that by appointment management of the distribution of that Sinopharm vaccine, utilizing the policy that is currently in play, 60 plus and under 60 with NCDs. So hopefully that clarifies.
Thank you very much, Dr. Hines. We'll now take an additional questions from Guardian Media Limited.
Hi, morning again. Okay, so now that we have the AstraZeneca as well as the Sinopharm vaccines being administered, a number of people have been asking if they can choose which vaccine that is that they take, and how do they go about informing the health center or wherever. How do they go about that process of choosing which vaccine they want?
Okay, thank you for the question. I'll answer two questions, although I didn't ask a second one. So the first thing is the vaccine that's available where you have made your appointment and received your appointment date is the one that you will receive. There isn't okay, well, I'll take Sinopharm, I'll take AstraZeneca at this point in time. The vaccines that are available are the ones that should be taken, because the best vaccine for you is the vaccine you can get into your system at this point in time. Noting that, this wasn't asked, but noting that the vaccines are not interchangeable. So if you got AstraZeneca, then you cannot go and say, well, I'll take my second dose in Sinopharm. The AstraZeneca supply that has been reserved for the second dose is available for everyone who got AstraZeneca to receive their second dose in AstraZeneca. And the importance of not trying to mix those can't be overestimated or overstated. So let's just make sure that we keep that in mind as we move forward.
Thank you very much, Dr. Hines. We now move to 98.1. We take your second question.
And thank you again, Mr. Alexander. Stephen Cummings, once again, 98.1 FM. Dr. Hines, I want to come back to you, and it seems as though you are on the front line of the receipt of a lot of questions this morning. Nonetheless, Dr. Hines, There was on the last occasion when we had the press conference, I believe it was on Saturday last, and Dr. Trotman spoke. She spoke of, apart from knowing that we are at critical levels in terms of treating with this COVID-19 infection, she said that what appears to be happening, or what she's seeing, is a new kind of COVID-19 patient, and the term troubled me somewhat. Are you able to say what Dr. Trotman may have been referring to, perhaps in clinical terms? I didn't quite grasp when she said a new kind of patient, or maybe I missed it somewhere on that occasion. Thank you.
Okay, thank you for the opportunity to clarify and reiterate. What Dr. Trotman referred to was the fact that when we saw the peak in September, what we saw was people who weren't quite as ill. They weren't necessarily symptomatic, and they were, when they were symptomatic, they weren't severely ill. They came in and they weren't the sort of acute patients that are being seen in this second wave. You're seeing patients who were A, a little younger, and B, a little more ill, a little more sick. So that was really the reference that was being made to a new kind of patient. You're seeing people with more serious illness, and that was a concern, because the more serious your illness is, then the longer you spend within your health system, and the greater the possibility that your outcome may not be favorable. Now, this doesn't mean that there is a change necessarily in what's going on at the viral level. It just means that we may be seeing the more extreme end of the spectrum as more people are ill in the population at this point in time. Remember, we have, as we said, the 8,000 plus total active positive cases. Of those, people may develop more severe symptoms, and they may present with more acute illness at this point in time. It's larger numbers, so greater probability of seeing a wide range of things. So that new kind of patient is really what was being referred to. And of course, when next to Dr. Trotman is available, she can expand on or correct as necessary.
Thank you very much. We go across to Tobago, and we'll take Radio Tambrin. 2 quick questions, please.
All right. Good morning, Clayton Clark from Radio Tambrin. My questions are, the first one, what is the level of concern for children and their levels of physical inactivity during this pandemic time? And my second question, what procedural advice would you give to persons who have been infected and have been treated and have recovered with regards to interacting with their families and the public? Should they still wear masks at all times? Those are my 2 questions.
So I'm going to take the second question first, and then I'm going to ask Dr. Othello if she wants to weigh in on that first question with regard to physical activity in children and the impact. That second question is extremely important, and I thank you for bringing it up. Treated and recovered or not, at this point, we are still asking, advocating, and insisting that everyone, also vaccinated or not, that everyone continue to wear their masks, continue to follow all of the public health recommendations and guidelines for reducing risk. Now, the other thing that we know sometimes happens, we saw it happen with the pandemic flu in 2009, we see that sometimes when somebody has been ill, then they're sort of labeled as patient X from disease X permanently, which is not necessary. Once somebody has been treated, once they've recovered, once they've been designated as recovered, there is no need to continue to treat them with suspicion and stigma, which we do know sometimes happens. So I want to raise that point as well. We want to avoid doing that. But wearing the mask, maintaining the distancing, maintaining the hygiene, which is required by everyone, isn't treating anyone with stigma. We're just trying to get everyone to do the right thing at this point in time. Dr. Othello?
Thank you, Dr. Hines. With respect to the decreased activity of children and implications that may follow, I want to point out 2 things. That has implications for both physical and mental well-being. We're familiar with the phenomenon called childhood obesity. So if this progresses for too long, It does increase the risk for childhood obesity, which we don't want because it, has implications for the long-term health of the child. And in addition, children need to exercise as part of their overall well-being, so that it can, in fact, impact their mental health if they're just indoors all the time, not getting any physical exercise. Right? Just as I emphasized the importance of physical exercise for adults, it is equally or even perhaps more important for children. So let us find ways, whether it's activities in the house or in your own yard, let's find ways to keep those children active.
In closing, we'd like to thank you for joining us for today's media conference. We really do appreciate the time that you take to view these conferences each week. And remember, we are all in this together. We urge everyone to do their part to safeguard the health of our nation. Be safe and enjoy the rest of your day. And please remember the 3 W's. Wash your hands, watch your distance, and of course, wear a mask. And of course, and I would just like to reemphasize what Dr. Othello mentioned, the 3 S's: self-care, support one another, and, if necessary, seek help. Goodbye for now.